movements of the sternoclavicular joint. Here, if we see sternoclavicular joint, here the possible movements what we will get here. The first movement is the elevation and depression. Elevation and depression. This is one, and second one will be getting protraction. Okay, protraction and retraction, protraction and retraction, and third movement. So the third portion, it is the anterior rotation and posterior rotation, anterior and posterior rotation movements, So these are the total 6 movements. Why 6 movements? We discussed sternoclavicular joint is a 3 degree of freedom joint. It is a triaxial joint. It is a triaxial joint. Triaxial joint. Okay, sure. Now we'll see elevation, depression, protraction, retraction. So all these movements here, whatever the movements are happening in the sternoclavicular joint, so these movements are happening in the sternoclavicular joint. Still here the lateral end, see this is our lateral end of the clavicle, When this side movements are happening, elevation, depression, automatically here the lateral end of the clavicle also will move. Suppose here if the lateral end is moving, automatically medial end also will move. And then if you see anterior posterior rotation of the sternoclavicular joint, here if you see anterior posterior rotation of the sternoclavicular joint, scapulus, here the clavicle, entire clavicle will rotate posteriorly at the same time anteriorly. So entire clavicle, not only here, the entire bone, it will rotate posteriorly, anteriorly. So these are the some points about the movements of the sternoclavicular joint. Now we see elevation and depression. Suppose if we see elevation and depression, here this same place this joint I am drawing here, this is the manubrium, this is the articulating surface. Okay, this is the articulating surface of the manubrium. Okay, just imagine. Okay, this articulating surface, leave it. Okay, now here we'll be having the clavicle. This is the clavicle portion. This is our clavicle. If we see elevation, when the elevation and depression, where these movements will happen, these movements are happening in the frontal plane. These movements will happen in the frontal plane and sagittal axis. This is the frontal plane and sagittal axis. Frontal plane means it is the surface where the movement is happening. Axis means it is the point where the movement is happening. Okay. Now if we come to arthrokinematics, here it is the convex. It is the convex shape. It is the concave. So head of the clavicle, otherwise medial end of the clavicle is the convex shape, and articular facet on the manubrium, it is the concave shape. So when the elevation and depression is happening here, it will happen in the opposite direction. I'll explain this. If we are doing elevation, if the patient is doing elevation means upward movement of the clavicle, the arthrokinematics, it will happen in the reverse, downward direction. So here in elevation, downward or inferior, gliding of the clavicle will happen over the manubrium. Understood the point? Suppose if you are doing depression, here upward or superior, gliding of clavicle over the manubrium. If the patient is doing depression like downward movement, so that time it is going to happen arthrokinematics. Here movements inside the articular surfaces, arthrokinematics will happen in the upward direction. So this is about the arthrokinematics. Suppose if you see the elevation, what is the normal range of elevation? Means 0 degrees to 45 degree normal range of elevation. If we see depression normal range 0 to 15 degrees is the depression normal range of motion. And one more point here, whatever the movements happening, this we discussed so many times, whatever the movements are happening in the medial end of the clavicle, these movements are also going to create the movements in the lateral end of the clavicle also. So if the medial and lateral end is moving, automatically scapula will move. Why scapula will move? Means the lateral end of the scapula, the lateral end of the clavicle, which is attached to the acromion process, that is AC joint, acromioclavicular joint. So the lateral end of the clavicle is attached to the acromion process. Acromion process is a part of the scapula. So that if the clavicle is moving, automatically scapula also moves. That is how we discussed. It's like a integrated function. One movement is going to create the movement in the another joint. Now we'll see the movements of the protraction and retraction. These protraction retraction movements of the sternoclavicular joint are happening in the transverse plane and vertical axis. See here, one typical point I'm going to say here. Recently, previously we saw the elevation, depression. Okay, so now we came to protraction, retraction. One small difference is there between these two movements. Suppose if we take this is our manubrium. So here clavicle was like this. Here clavicle shape is convex. Manubrium is concave. Okay. When elevation depression is happening, only clavicle is moving. But if we come to protraction retraction, if we take this is the manubrium. So here we'll be having clavicle same convex and concave. Okay, concave. Between these two here we'll be having one special structure, that is the sternoclavicular disc. Okay, so when we see the sternoclavicular disc, this already we discussed in the sternoclavicular disc. If the elevation depression is happening, only clavicle will move. If the protraction retraction is happening, mandible will mean this manubrium will be like fixed. Manubrium is like fixed. Here both the clavicle and disc together will move. So that means here we can understand that together will move. So here the shape of the The shape of the disc here, the shape of the disc will be like little concave. The shape of the disc will be like little concave. So that here the point we can understand when the movements are happening. When the movements are happening like protraction and retraction, the concave surface of the article, the concave here, it will be like concave. Okay, articular disc will be like concave. The concave articular disc plus clavicle will move on the manubrium. So here we know the point. When the concave is moving on the convex articular surface, all the arthrokinematics like gliding, sliding, rolling, spinning will happen in the same direction. Now we'll see what will happen in protraction. In the protraction, the clavicle will do like anterior sliding over the manubrium plus first costal cartilage. So here the clavicle and disc together will do anterior sliding like this, anterior sliding movement over the manubrium and first costal cartilage. If you see retraction, here clavicle is going to do posterior sliding over the manubrium plus first rib. So this is about the protraction and retraction. If you see protraction, what is the normal range of protraction? 0 to 15 degrees protraction. And if you see retraction, normal range also 0 to 15 degrees. This is about the protraction and retraction of the sternoclavicular joint. Now we'll see anterior and posterior rotation of the clavicle. Now we'll see the last movement, anterior posterior rotation of the clavicle in the sternoclavicular joint. So if you see anterior posterior rotation, here these anterior posterior rotations will happen in the transverse plane and vertical axis. Vertical axis also called as the longitudinal axis. Okay, now we'll see rotation. The clavicle bone, it will rotate entire bone. If you see other long bones, suppose if you see humerus, so here it can rotate in this end and it can rotate in this end. But if we come to clavicle, it is not like that. It is having only one rotation. Suppose if the rotation is happening in the clavicle, entire clavicle will move. Suppose this is the medial end, this is the lateral end. Suppose here the rotation is happening, means it's not possible. Here the clavicle is going to rotate, entire clavicle will rotate. So now if you see anterior rotation, and the first one we'll see posterior rotation. Okay, if the clavicle is going for posterior rotation, see like this posterior rotation, the entire clavicle, now we are seeing it anterior, the entire clavicle will go for posterior rotation. When it go for entire clavicle posterior rotation, we can see the inferior surface. The entire clavicle will go for posterior rotation, so that we can see the inferior surface of the entire clavicle. So if the clavicle is coming back to normal, that time anterior rotation will happen, then clavicle will come to the normal position. So this is about the anterior posterior rotation of the clavicle, plane and axis. What is the normal range? Usually these rotations will happen 30 degrees to 55 degrees. This is the normal range of the rotations in the sternoclavicular joint. So this is about the movements of the sternoclavicular joints. Clear?